welcome to the Shatkin First Monday Morning Minute. So good morning and welcome to this week's Monday Morning Minute. We're coming a little different to you this week because we have Dr. Matthew Lasorsa joining us almost all the way up from Canada. I know you're in upstate Vermont, but we're excited. Lenny and I are really excited because we wanted to talk to you. Yeah, we want to talk to you a little bit about what you plan on doing at the end of this month in Buffalo at our advanced course with Gordon Christensen. I know that the course is going to go on the 27th, which is Thursday, the 28th, which is Friday, and Gordon will be speaking on the 28th. And then the 29th, we have a problem-solving course with you as well. Now, Dr. Shatkin's brother, Samuel, is also going to be doing a Botox course, but this morning we're going to talk a little bit about what the problem-solving course is. What can someone who's coming to your course expect, Dr. Lasorsa?
Well, I try to hit on a lot of subjects that maybe there's no time to do in a weekend course or a one-day course, because, implant dentistry is not just about, placing the implant, restoring it. There's so many other factors that you have to think about before you even come up with a plan. Are you going to treat this patient? How are you going to treat this patient? How is this patient going to react or heal or even maintain the implants afterwards? So, I start off at the beginning showing all the big game changers I've seen in dentistry through my career and the things that are still going on now, even the differences in the implant threads, the implant surfaces. We've all seen improvements over the years. So I go into that a little bit, the things that have helped me a lot, like the CT scan, number one. I mean, I can't live without it. I don't know how anybody can place an implant without it anymore. And it is considered the standard of care. The cube to do tough extractions this is one of the things I'm going to talk about, take out fractured implants. It happens. You get a fractured implant. They're tough to get out. The cube helps with that. It helps trough around them, so it makes your job a little bit easier. Sometimes they're buried in there pretty good. But then I go into the basics that everybody forgets. I've been an expert witness on a lot of litigation cases, and the things I've seen the plaintiff's attorneys target is the lack of diagnosis and the lack of documentation before bringing this patient into treatment. So I go into what they're looking for as far as, and what the ADA is looking for as well, as far as a comprehensive exam or a consult, documenting their medical history, what kind of medications, what kind of consults do you need? Do you need second opinions on anything? Do you have to alter the medications on anything? Do you have to treat this patient differently because they're on these medications, whether it's cardiac conditions, diabetes, smokers, drug addicts, somebody that has autoimmune disorders, someone that's on bisphosphonates, anything in their medical history that is going to affect their implants or affect their treatment. That's what we want to figure out. Vitamin D levels, if they're taking antidepressants, there's a lot of these things that can factor in on whether your treatment's going to be successful or not. And if you have that knowledge and you have this patient that's medically compromised by, let's say they're a diabetic, they're a smoker, they're on antidepressants, vitamin D is low, it's just an array of things, and they want help, they want treatment, you have to talk to them and document ahead of time, okay, we're going to do this for you, but you have to understand, you're not a 19-year-old young, healthy patient with no medical problems. There's a lot going against you. And we're going to give you the best treatment possible, but you have to understand you come in with a lot of risks to doing this treatment. So, that being said, it's not that you're lowering their expectations. You're just getting them to understand that because their friend had an implant, everything went fine. They're not a clone of their friend, okay? And it might be a different implant system, different situation. They have to understand that their situation is unique and that the treatment plan you're going to come up for them is unique. It's catered to them. It's not, a walk in, pull it off the shelf, here's your treatment plan. It's catered to them. After that, after going into, medically compromised patients, I mean, I've even treated patients that have had irradiated jaws from cancer, and they've all been successful. There's a real complicated one I'm going to show that it's still successful, but, there was some compromise in there over the years. Then I go into Some of the litigation cases I've done, I can't name any names or even name the state it was done in, but I can explain the situation. And pretty much every case I've ever taken on, the dentist did everything right, but the opposing side was upset because either they had pain or they had unrealistic expectations, or the lawyer just hired a dentist that was willing to say this was done wrong, this was done incorrectly, this was done below the standard of care. And I think I've done dozens of them by now. There was only one I saw that I thought there was some kind of negligence. Every other one, I had the case settled and I had the case thrown out because the dentist really did do everything right. They could have made things easier by making the documentation or things a little more clear or better consent forms. That's another thing I should bring up. There's going to be about 30 different handouts for protocols for
Wow.
people with bisphosphonates, people who have cancer, for phlebotomy, for bone grafting, for oral surgery, for implant surgery. All those things, there'll be consent forms for that are very thorough and go over everything. There'll also be protocols for if you have a certain type of situation, what do you do? If you have a nerve injury, what do you do? If you have an implant going in the sinus, what do you do? If you have bone that's too soft, you don't get any torque, what do you do? If you have bone that's too thin, you can't figure out where to put the implant. You try to put the implant in, it shatters the ridge. What do you do? If the bone is so dense that it doesn't bleed, sometimes that's a bad thing. You need some bleeding for healings. What do you do? So I'm gonna have a list of protocols for what to do in those situations. And after that, then I kind of show examples of each one of those situations and how I got through it. And some of the things I've repeated again and again, and sometimes the situations only come up once or twice. And those things are going to pop up. There's a situation you've never been taught or trained, and you have to figure out how to get through it and how to get through it successfully. What do you do with a failed implant situation? Well, you got to figure out why it failed. Is it the host? Is it the patient? Is it the occlusion? Is it their hygiene? Is it something systemic? We'll go into that, and I'm just going to show a lot of different cases, whether it's for fixed cases or removable cases, and then towards the end, I'll show that these complications that I show, it's not limited to mini implants. I can show you plenty of complications with conventional implants. I do place a lot of conventional implants, and they all have the problems. Nothing's 100%. I mean, if you have a knee replacement, it's not 100%. You're not running marathons the next day. If you have a tooth replacement, it's the same thing. It's a great option, but it doesn't mean, it's like you're 6 years old and you go the rest of your life with this tooth. That's why we're replacing teeth, because they don't last your whole lifetime. So that's basically it. I mean, and it's going to take all day. The first time I gave this course, I think I had like 430 slides. I'm still working on the course day by day. I have over 1,000 now.
Wow.
So I'm going to try to get through material and obviously take some questions. And aside from that, I'm not just going to talk about complications or problems. There's a lot of tricks and tips in there that, either I learned from somebody else, or I read it somewhere, or it's just something I've figured out that will help everybody. There's a lot of things you can go through to make your cases a lot easier and a lot more successful. And sometimes it's just something that no one ever thought of before. And it's fairly easy to do. It's just, it was something never thought of. That's all. So, I look forward to it because this is everything I got. This is, I've been doing this for 25 years. This is everything I've got going into this.
Wow. I'm so excited myself because I've never got to see one of your problem solving lectures before. I've just heard about it from the doctors and from Fitz and the team. Not the problem solving. I've listened to you lecture before, and that's been phenomenal. It's always engaging, and I'm always learning something new. Even being a sales rep here at Shatkin First, because everything I learn from those lectures, something when I'm sitting in listening to you, I'm talking to the doctors every single day, and I'm relaying all those tips and tricks that I'm learning from you, but I've never actually listened to a full day lecture from morning to the evening where you're doing this problem solving and just kind of touching up on those points that you just mentioned right now, those protocols, those documentations. I mean, a lot of the questions I get really relate to that sort of stuff, right? Or those tips and tricks where,
Right.
if the implant fails or, hey, I ran into this dense bone, we've talked about it at the course and, we briefly provide solutions, but I'm excited to hear what you have to say because I have a feeling with 1,000 slides, you're going to get really in depth and really lay it all out for these doctors. So that way, when they leave, that they're not going to be thinking, hey, what if this happens or what if that happens? You really are laying everything out on the table, it sounds.
Yeah. And
As
Lenny,
much as I can.
let me chime in for a second, Dr. Matt. So I've had the good fortune of being with Matt down in Florida. And we've not only lectured up here in Buffalo at our training center, but we've also lectured in your dental office. We've lectured on LPRF. We've lectured on the bone grafting and how important it is when you're using the intraspin. And we've had hands-on workshops down there. And we also, Dr. Sam has also done a Botox course down in Matt's office in Florida. And we've also done problem solving down there. So we've had a good amount of people down there. And I'll tell you what, every single doctor that I talked to that's attended that course, they can't say enough about it and how educational it was. And we're going to try to capture that same feeling, and even more so now up in Buffalo on the 29th of June with Matt talking. You have 1,000 slides to go over, and every single hour, it's just you're going to gather so much information on the priceless. So it's well worth its weight in gold.
This really should be it really should be a 2-day course, but I don't have that option on Saturday, so I'm just going to get it all in.
Yeah,
we'll get through it.
Yeah, 100% we will. There's not a doubt in my mind.
That's awesome. And Dr. Lasorsa, those protocols, the doctors are going to be able to take all of that with them and kind of just take it and fit it into their practice, maybe change up the names and different things like that. Obviously, I'm sure state to state it's a little bit different, but they can use that as.
Some of them are on my slides. I did have one doctor request, hey, do you have those protocols written down? Some of them I do and some of them I don't. So that's what I got to work on this week.
Okay.
I'll send them over to Jennifer so that somebody can, and some of them are just, they're my opinion on things, right? What implant to use where, why, right? That's just what I've found is the most successful. This is my choice of implant and this is why. Or or here's where I would do removable, here's where I would do fixed. Why? Because I see other things going on. I think removable would work better in this situation, or I think fixed would work better in this situation. So things like that. Okay. That I don't know how to say this. There's nothing set in stone. This is just what I've found to be better than, just a cookbook, one size fits all. It's not true.
Yeah.
You have to cater to, and that has to do with, number one, their medical history, number two, their desires, their needs, and then number three, the finances. Right. So I want to be able to treat just about every patient that comes in. Here's another thing. You got to look for red flags for patients you don't treat, right? That takes a while to learn. You first start doing implants. You want to treat everybody. You do it for long enough, you start to pick up, I don't think I want to treat this patient because they're going to be very the rest of my career. Maybe this isn't somebody I should work on. And I do talk about that, some red flags you should pick up.
That's huge because at so many of our intro courses, when we have these new doctors that are just starting to place mini dental implants, we talk a lot about case selection, right? And picking the right cases, not, starting off, but really even as they start picking up steam and they start moving on in their career placing these implants, case selection is still huge no matter where you are, because if it's not the right patient or it's not the right fit and you take that on, just like you said, it might cause a bigger headache for that doctor in the future than it is to actually just take that case on right then and there.
Case selection, before you take on a case, you want to make sure you can confidently do that case. You have to, step outside the box a little bit if it's something you've never done. But you know, don't start off with the hardest case in the world. I just did a tori removal case. I posted it on the Facebook group. That was the hardest tori removal I have ever done, and I never say no. If you're going to start with a tori removal, don't start with that one. You know, that was pretty challenging, and I have some follow-up photos for that. He's healing pretty well, but yeah, that one definitely raised my blood pressure. That was a tough case. You know, sinus lifts. I do sinus lifts. I've done a lot of them. I was so proud of the ones I did. It was the same day I did a tori removal. And second sinus flare up I've ever had. Both times, it was the last day I was working before I went on vacation. The last time I had a sinus flare up, it was about 7-8 years ago. Last patient before I was going on a plane, and sure enough, I get a call from an oral surgeon up here because the sinus had blown up. And you know, I thought the sinuses came out very well the other day. I get a call once I'm up here, 2 days later, that the sinus is blowing up. So I had to send him to an oral surgeon. He wears a CPAP, and some dentists try to say, well, don't wear the CPAP for a week. You can't do that. You know, that's something I'll talk about. If you do any kind of sinus lift procedure, if you get a sinus perforation, doing an extraction, something like that, the patient wears a CPAP. Do not tell him not to wear the CPAP. Having a sinus flare up isn't the worst thing in the world. If he doesn't wear the CPAP and he doesn't make it through the night, that's a big problem.
Yeah.
Right? Because that's happened.
Huge.
It happened at Medical College of Georgia a couple years ago. In the faculty clinic, they did a sinus lift on this patient, told him not to wear a CPAP. He died. So there was a big lawsuit against Medical College of Georgia. So I'm okay with having a sinus complication. He's still around.
Yeah.
You know what I mean?
Absolutely.
So
100%. So, okay, well, I'll tell you what, Matt, it was great of you to take some time away from your fishing and your vacation up in Vermont. I mean, this is awesome. We're all so excited at Shatkin First to have you back here for our course at the end of the month. Yeah, and we got a lot of great doctors coming in for the course. Yeah, it'll be a 3-day course, don't forget. And you do have an option of doing Botox as well with Dr. Samuel Shatkin. So you choose.
Which I would recommend for everybody to take, because managing bruxers after implants is an issue, and Botox has really helped me out with that. So everybody should take Sam's course.
Awesome, great tip.
Right.
We look forward to hearing many more tips from you on Saturday. And Lenny, what do you think, boss?
Like I said earlier, I'm excited. I mean, I'm going to have my pen and paper in the back. I'm going to be taking notes down, because just like every doctor that comes to our courses, you know, they're always picking up something new. And I'm at every single course, but I'm looking forward to hearing from Dr. Lasorsa and all the knowledge that he's collected over the last 25 years. Because I know, you know, for the doctors that unfortunately won't be able to attend, I'll be able to use that knowledge and pass it down to them however I can. But you know, I highly encourage any doctor who's listening to this Monday Morning Minute and what Dr. Lasorsa just had to say. If you can stay that third day, if you're already coming, change your flight plans, you know, book an extra night, stay and listen to Dr. Lasorsa. And if you haven't already scheduled or registered for this course, make sure to do so and spend all 3 days, because there's so much knowledge, there's so much value in attending that it can really help take you to the next level in your practice. I truly believe that.
Yeah, and don't forget, the weather's absolutely beautiful in Buffalo.
It is right now. It's perfect. It's perfect. It's like Florida.
Warm. Yeah, it's really nice. So
right up there too. So I think we're at about the same latitude.
Yeah, I think so. I think we are. So, all right, gentlemen, thank you so much for this Monday Morning Minute. I think it was awesome. We hope everyone out there has a great week placing mini and mono implants and whatever implant it is that you're placing. But we look forward to seeing you up here in Buffalo, and have a great week placing mini implants, okay? Lenny and Matt, have a great week as well.
Thanks a lot, Dr.
Lasorsa.
Lasorsa.
Forward to it.
Okay. Thanks a lot, Matt. Appreciate it.